Hello, friends. This is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. Today, we'll be dissecting a podcast hosted by someone else with Brigham Euler, who is a compounding pharmacist, and he shed the light for me on how the insurance company, the medical insurance company, is part of the system. You remember in my book, Stealth Health, we talk about the system, capital T, capital S, which has been making us sick our whole lives. The system includes big pharma, the food companies, the chemical companies, the conventional medical model, insurance companies, the media, and unfortunately, research and academia get mixed up with this as well. And it always made me curious as to how the insurance companies would want to pay for more expensive treatments, more testing, with little care for the outcomes, and actually outright discriminatory against healthcare methods that are truly healing, that would take people off of medications and um, and remove the necessity for further testing and routine testing. Always baffled me. Well, Brigham has brought this to light in this podcast. And what I'll do is I will explain what I'm hearing, and then I'll play short clips for you. And as you know, I wrote Stealth Health prior to 2020. And one of the books that I used is The American Sickness by Elizabeth Rosenthal. And Elizabeth Rosenthal is an MD who worked for a short time in the emergency room in New York City and then went on to become an investigative journalist. And this is a book chock full of data and numbers and the raw truth about the conventional medical model, big pharma, the insurance companies, etc., and your health and my health. Notice when I talk about insurance companies, I don't say they are health insurance companies because they are as far away from health as they could possibly be, because they will only pay. And I use that word only pay. I use the word pay very loosely because it turns out that they really don't want to pay for a diagnosis and a treatment or testing related to a diagnosis. So a diagnosis means that you have a sign or a symptom that can be named by a medical doctor as an illness. So they do not pay for health care, they pay for disease care. Also, back in, I don't know, was it 2010? I don't even remember, when Congress approved the ACA, Affordable Care Act. And I love calling it the Affordable Care Act because it is so far from affordable as it could be. It is nothing like what was promised to us. I noticed with my own patients and that their costs went up for insurance coverage, and the payouts were less and less. Nothing was as promised. And it turns out, as I researched to do this podcast, that the profits of the insurance companies actually has gone up since then. And I said at the time, the insurance companies will not miss an opportunity to make a buck. They will not. And they used the ACA, the Affordable Care Act, to do so. So I will, this first clip I'm going to show you talks about the origins of the insurance companies, which are, I talk about in Stealth Health, them being nonprofit, very often started by religious organizations for a local town or community. And Brigham Bueller talks about in the 1980s, the HMOs came on the scene, and that was at either coast, in New York and in California, which turned the medical model, turned medical care into a profit center. And that's what we now are stuck in. We are stuck in medical care as a profit center. And you probably have noticed that over time, this is from the AARP bulletin newspaper, where have all the doctors gone? Because the large medical corporations have gobbled up the small doctors' offices. If you're lucky to have one in your neighborhood that you could go to that's not part of a large medical conglomerate, count yourself lucky. And now you can't get a call back. You can't talk to a human. If you have an issue or a problem, good luck talking to somebody. The doctors are unavailable to speak to, even for myself as a healthcare provider and somebody that orders MRIs. Very often in the past, I saw something on an MRI that I didn't see listed in the report, and I could call up the radiology center and speak directly to the radiologist that read the MRI. I can't do that anymore. I have zero access to that. It's like, oh well, healthcare provider out there who is interested in helping the patient, you don't get a chance to talk to the radiologist. And it's sad. And the person that really suffers is the patient, because the care is less and you feel less compassion. And maybe there is less compassion. So let's see. So I'm going to play this clip for you. And this clip also talks about how the insurance companies control how much your doctor and your doctor's facilities get paid, and also how chronic diseases are very profitable. Alicia, this is minute 36 seconds through minute 4, 24 seconds. In this next clip, and this is the most fascinating, Brigham Bueller talks about PBM, pharmacy benefit managers. These were formed in the 1970s to be an advocate for the American people to drive down the costs of prescription drugs. They acted as a middleman, but interestingly enough, the PBM companies were bought by the insurance companies. So these PBMs, the pharmacy benefit management companies, became a profit center for insurance companies. And how it works is that 30% of a drug cost gets kicked back to the insurance company as pure profit. And there are medications that for you, the patient, when you go to fill a prescription, there are medications that are on the list for your insurance company's coverage, and some are not. And it's not because that medication is better. No, it's because your insurance company is getting a kickback on these medications. So therefore, those are the only ones they will cover. Who knew? This is crazy stuff. So give a listen. Alicia, this is minute 5 and 22 seconds through minute 6 and 4 seconds. Crazy, right? In this next little clip, now I tried to verify these numbers. And I kind of got on this merry-go-round. Let me share a screen with you. You know that I like to be sure that I am giving you the data. I don't just trust an article. I go to the source. And I'm sure this data is available if you were to go to, I don't know, stock market information. But here we go. This first piece of data is top 5 largest US pharmaceutical companies earnings. Now, this is profit. This is over and above what they pay for marketing, development, blah, blah, blah. Nearly $82 billion last year. That would be 2023. And, then I click on one of their sources and it leads me to this document. But the title of this document is As Americans Struggle to Afford Life-Saving Drugs, comma, the nation's 5 largest pharmaceutical companies continue to drive inflation. Okay, well, that's an inflammatory title. So that certainly this is not data, because if it was purely data, it wouldn't have this hook to it. As Americans struggle. That's not pure data. So it makes me not want to trust it. Let me share again with you. And so next is this. I have these 2 headlines, and this is the same exact article. Top 5 U.S. health insurers' annual profits jumped 230% since the ACA's passage. Remember, when we talk about 230%, that would be 2.3 times. So that's still a lot that their profits jumped 2.5 times. And it is an article written by this Helen Santoro. And then we have this next article. This is, again, Helen Santoro, same exact article. Health insurers' profits are reaching new heights. So where big pharma profited 82 billion in the year 2023, the insurance, and that's the top 5 big pharma companies, the top 5 insurance companies profited 371 billion. So we tend to just focus on the pharmaceutical companies, like all evil, like out to get us, like putting drugs on the market that are honestly dangerous. Because the FDA holds the drug companies responsible for safety. The FDA does not screen for safety. That is the responsibility of the drug company to only release something to market that is safe. What? Let's fix that one too. Okay, so we think the big pharma is like evil and bringing in $82 billion in 1 year just to pure profit. But here's the top 5 insurance companies bringing in 371 billion. What is that, like 4 times more in billions in a year? All right, so this next little tidbit I'm going to play for you talks about exactly that. And that for the insurance companies, 60% of their revenue, and remember, this is pure profit because it's just kickback, 60% of their revenue is from those pharmaceutical benefit managers, which is a company. Listen to this. Alicia, this is, oh gosh, dog it. Where is it? Alicia, that was minute 6 and 53 seconds to minute 6:58 seconds. Now, in this next clip, when current healthcare advocates are speaking out and they talk about the system, which is making us sick our whole lives. I was the first one to coin that phrase, and I am so proud. And you know what I'm proud about? I am proud that it is now a conversation. We may not see things change overnight, and we won't see things change overnight, but it is a conversation, and now it is on everybody's lips, and we are allowed to say, well, why? Why is this happening? In this next clip, Brigham talks about how chronic disease is caused by our foods and our lifestyles, and how the system is failing Americans. And chronic disease kills so many people, and not only kills, but I have to tell you, I've been in practice for 30 years. People younger and younger and younger have a longer and longer list of illnesses, diagnoses, reasons to feel bad, fatigued, ill, pained, and it's heartbreaking. And that's why I'm so glad that this is a conversation now. It's not just me sitting in my office, writing and thinking and doing podcasts. Alicia, this is minute 9 to minute 9 and 48 seconds. And in this short snippet, Brigham talks about the pillars of the system that are making us all sick. Alicia, this is minute 10 and 11 seconds to minute 10 and 25 seconds. And I know you've heard me say this many times before, but the system is designed to make you sick. And the reason being is that these companies don't make money on you being well. These companies don't make money if you're not getting drugs, getting tests done, getting medical interventions. So they make money on you being sick. This is minute 12 and 50 seconds to minute 13. So now I have to tell you, this podcast goes on for an hour and a half, and I only had you listen up to minute 13. So there is so much in this podcast. We will put the link in the comments. The best way to take back your power, my subtitle, Take Back Your Power, is to avoid all possible prescriptions. Become your own best expert. Surround yourself with an arsenal of people that that are holistic in their thinking. Have in your personal arsenal a whole list of holistic health providers, like I do. I have 2 or 3 chiropractors. I have a homeopath, a naturopath. I do massage therapy, cranial sacral therapy, many, many different things to keep my body well. Because if we can give our bodies what they need and remove interferences to our health, we will be the healthiest we possibly can be. So be well. As always, my hope for you is that with each passing episode, you get closer to being your own best ex. So, as always, with each passing episode, my hope for you is that you get closer to being your own best expert. Bye for now.